Hi, I'm Femi OK, and you're in the stream. Today, prison pandemic. People are trapped inside US prisons infected with coronavirus, but should they be? We want to hear your thoughts on this one. Tweet us at AJ Stream or leave a comment in our live YouTube chat to join the conversation. Prisons are supposed to be some of the most secure places on the planet, but despite the high security, prisons across the US haven't been able to keep the coronavirus at bay. One notorious COVID-19 hotspot is California's San Quentin prison. The outbreak there is the subject of a new film by Al Jazeera's Fault Lines. Have a look.
One of America's worst coronavirus outbreaks in a prison happened in California after infected inmates were transferred from one facility to another.
No ventilation, windows are welded shut, so everyone is breathing the same air all of the time, every day.
For a week straight, there'd be these alarms. It's called man down.
Man down, man down, man down all day, all night.
Fault Lines asks who is responsible. Pandemic in prison, the San Quentin outbreak, on Al Jazeera.
Joining us from California to discuss the issues of COVID infection in US prisons, Adnan Khan. He's the co-founder and co-executive director with Restore Justice. James King, he's a state campaigner with the Ella Baker Center for Human Rights. And Danielle Harris, she's a managing attorney with the San Francisco Public Defender's Office. Hello, everybody. It's really good to see you. James, as you watched that Fault Lines documentary, as you took part in that Fault Lines documentary, it was just a short period of time between when you were incarcerated, when you were released, and when that outbreak happened. When you put all of that together, what do you think?
I mean, for me, it's been incredibly nerve-wracking just to think about the fact that I made it out maybe 90 days prior to the largest clustered outbreak in the country. And it was in many ways just good fortune smiling down on me. It could have been anyone. It should have been several people. So just like knowing that there was nothing distinct about me that created that timeline, but just the way things lined up that then happened to prevent me from going through it while thousands of others did has been really hard to reconcile, frankly.
There's a moment in the documentary where a nurse who's working at San Quentin anonymously explains what happened. I just want to play that because it is just frightening hearing it. Have a listen, everybody.
We were running from man down to man down. It was almost nonstop. 4th of July was the hell week. That was the peak. There are patients everywhere in the hallways. They're waiting outside of the building because there's no room to get into the healthcare building. Even if you're having chest pain and you said that you feel short of breath, even that was not enough for you to get immediate medical care. We had to check your oxygen to see if in fact your oxygen was okay. We were grossly understaffed, and we were completely overwhelmed.
And then it was about 7 months ago that the stream had to take a break because of COVID-19. We came back. The very first show we did was about the risk of COVID outbreaks in prison. And here you are talking about COVID outbreaks in prison. This was expected. You warned people about it, not you, but many advocates. What went wrong?
I mean, one thing that went wrong is that they didn't listen to the advocates and the experts, the infectious disease experts, the doctors, the people who are formerly incarcerated, lawyers. The people who are in charge, who makes these decisions, did not listen to the experts. And that is exactly what went wrong. And in the midst of all of this, we had a huge botched transfer of incarcerated people from one of the deadliest prisons in Southern California to San Quentin. That created this outbreak. This is one of the largest tragedies in the prison system that I'm aware of in recent history. And that is actually a problem that we're seeing nationally, is people in charge in these positions of leadership are not listening to the experts.
It was a facepalm moment, what happened at San Quentin prison, because up until then, the cases had been, as far as we know, 0 cases. Then what happened? James, you pick up the story because I know you've got friends who are still in San Quentin.
Absolutely. And one of the things that I think about often is we don't know that there were no cases within San Quentin prior to the outbreak. What we do know is there was very little testing occurring. And then when they finally started testing, because so many people were going man down and it was requiring them to test, within 2 weeks, over 1,000 people became infected. So you can imagine, and that's out of a population at the time of about 4,000 people. So 1 in 4 people within 2 people in this very small clustered gated facility, prison, became infected very quickly. And there was no room to put them. So everyone, if you were in a cell, the cells are 4 feet by 9 foot wide, and your cellmate became infected, then that cellmate stayed right there, and you just waited for the inevitable. You would have it shortly. And that was the understanding, the expectation, and there was nothing to do about it because the prison was so overwhelmed so quickly.
Daniel, I'm just looking at something here from the OIG on my laptop, the Office of the Inspector General, Independent Prison Oversight. Just going to scoot down here on my laptop. It says here, the California Department of Corrections and Rehabilitation distributed and mandated the use of personal protective equipment and cloth face coverings. So it looks like they knew what they had to do. How did it go so horribly wrong?
Well, the Department of Corrections, which is the agency that oversees San Quentin and all of the prisons in California, makes a lot of policies, but they are less adept at ensuring adherence to policies by their own staff. And so what the Office of the Inspector General found, and that's sort of a watchdog agency that has the power to inspect the prisons, unfortunately not the power to mandate any changes, but what they found is that the department, which is massive, 63,000 employees, we're talking about a department that spent $500 million last year on overtime alone. So it is a massive organization. And what the OIG found is that they weren't enforcing masking requirements. So when, of course, when we put folks in prison, a lot of folks, as we have done, we remove from them the ability to take care of their own basic needs. So when we do that, we not only are punishing people, which we certainly are, but the state is taking on a huge obligation to care for the daily physical needs of these individuals, their food, of course, and their health care, and to protect them when something like this pandemic happens. So if staff aren't doing what we all know, at least those of us who are willing to listen to the experts, if they're not wearing masks all the time when they're at work, there is no doubt that that is going to contribute to the spread in the prisons. Because there's no such thing as social distancing in prison in California. Even if you are placed in a cell by yourself, at least at San Quentin, and you can see here what the structures are, there's in most of the buildings in San Quentin, there are 5 levels of open cells. Each cell has bars and mesh on it, but no solid door. So it's not just the person in your cell who you cannot social distance from, it's anybody walking by, and it's actually folks on the tiers above you too, because of the shared air and the terrible ventilation that doesn't really allow the air to get transferred in and out of the buildings.
James, there's a voice, and Adnan. James, you go first. Go ahead. Yeah. Yeah,
I just wanted to add one thing to that. Danielle makes several excellent points, but one thing that the vast majority of those 63,000 employees that Danielle just mentioned go in and out of the prisons every day in 8-hour shifts. So the idea that these are somehow prison outbreaks and that this can be isolated to prison incidents is a large part of what we've been advocating against. Each one of these outbreaks, and when you just look at incarcerated people, there are outbreaks at 20 different prisons right now. When you look at staff, there's an outbreak at every prison in the state right now. And each one of those staff members in outbreaks, those people get off work, they take their uniforms off, they drift into the community, and there are no parameters set in place to reduce the congregate settings that are acting as and can act as super spreaders in the larger communities.
So I want to put this to you, James and Adnan, because there's an empathy gap on YouTube right now. So North Angel 10 says, 9, excuse me, if they are in prison, they stay in prison until their time is up. End of story. Another one along the same lines, Short Fish says, since when is a crime worth death? So there's two alternate conversations going on there. But you also mentioned the staff that work in the prison. Adnan, you pick up there because if people have an empathy gap, there are also staff as well. Go ahead, Adnan.
I want to add to that. I mean, I think that if people are only looking at we need to protect the staff and not incarcerated people, I really feel like that this is a very individual question that we need to ask ourselves as human beings, as the person that we want to become. What is it about us as individuals that want to harm others, regardless of what they've done? And another thing is that our understanding of safety and who commits crimes, why crimes are committed, how to restore people is totally lost on society. What we believe is, okay, you did the crime, you do the time. No one ever understands what doing time truly means, and if that is what's providing safety, not just for people who are in society, away from people who are incarcerated or people who are coming back to society, but true safety really is people who are coming back into society, making sure that they're safe, making sure that I'm safe, that James is safe. And so safety isn't a one-sided road. And COVID is showing that. If I have COVID and I'm walking around in the streets and in your grocery stores and in different areas in your malls, are you safe? No, you're not safe. So safety is not just keeping James away from Adnan or keeping Danielle away from James. That's not what safety is. Safety is restoring the humanity in people. And last thing I will say that by the time I was 17 years old, I was a parentless, homeless, high school dropout. At the age of 18, under those conditions and with layers and layers of trauma and abuse, I committed a crime. I'm not excusing my crime, but what I am saying is that when I got to prison, there was nothing in prison that told me to say sorry. No one in prison told me to be accountable. No one in prison asked me to be to apologize to the victims, to make an amends. No one asked me that. And so when we look at safety, people completely misunderstand what safety is because it's been sold to us as a product by policing and prisons. That's the problem.
There is a voice that is missing from this conversation, and it's a tricky voice to get, and that's the California Department of Corrections and Rehabilitation. Look here on my laptop, because I do have at least some current figures here. And if you look at this chart, it tells us how many people in the state of California who are incarcerated currently have COVID or had COVID. So currently in custody, over 700 active cases. Just over 400 people have been released while they had COVID. Resolved, that's an interesting word, isn't it? Resolved, that means that they've probably recovered from COVID. I'm not sure that their situation has been resolved. And this figure here, 80 deaths. So how many people have actually had COVID in the California state prison system? 16,000 people. We couldn't get their voice in this conversation. Fault Lines also tried. Here is my colleague, Dina Takori, on the efforts that she also made to see if they would talk to Al Jazeera.
In an emailed statement, a CDCR representative said they implemented unprecedented measures to address the COVID-19 outbreak at San Quentin. After transfers from CIM tested positive, they set up a 220-bed alternative care site, provided all staff in the incarcerated population with N95 respirators, and sent hundreds of additional staff to San Quentin.
Daniel, there's a tweet here that you shared, and it says, 10 days ago, and this was in July, I wrote 60 people living in San Quentin offering advocacy. Today's return mail. Let me just scoot up and just see here. Look at this. What did they need from you? What help did they need, Danielle? Go ahead.
So they needed to know that people were paying attention, that people cared, that people were working to try to better the situation for them, I think. It's interesting that CDCR continues to say that they took extraordinary measures as if they did all they could, notwithstanding the fact that the Court of Appeal has said that the inaction in San Quentin by those same officials has been, quote, morally indefensible. We have a situation where the measures CDCR took may be unprecedented because we're in the midst of a global pandemic, the likes of which hasn't been seen in the lifetime of anybody living today, but it's been grossly inadequate. And that's why we are in the situation we are in, where there was an explosion of COVID at San Quentin this summer, and in July, people began dying at San Quentin. Those 29 people, 28 incarcerated people, and 1 staff member who have died should be alive today. That blood is on the hands of CDCR officials. And the reason that they don't speak really publicly, I think, is that they are used to operating in complete secret with complete impunity, and there's no accountability. 29 people died at San Quentin, and where is the accountability for those deaths? Our prison system is built on this notion that people need to be held accountable for the decisions that they made. In June, a team of independent experts told CDCR officials that they needed to cut the population of San Quentin in half, or people were going to begin dying. And they refused to listen to that advice, and 29 people are dead. Where is the accountability?
So, guess, let's talk lessons learned and maybe where we are right now. I want you to have a listen to Adamu. He introduces himself, he tells his own story. I'm just going to leave him to it. Go ahead.
My name is Adamu Chan, and I was incarcerated at San Quentin State Prison during the height of the coronavirus outbreak that happened there. And at no time during those months did I feel like the health and safety of the incarcerated population at San Quentin was a priority for the administration or for CDCR officials. And what I witnessed was that the vast overcrowding in San Quentin and at all the prisons across California was a huge factor in kind of exacerbating the spread of the virus through that population. And so any solution has to start with mass releases.
Mass releases. I'm going to put this question to you from YouTube, James. This is from Moss. How willing are the authorities to release prisoners? Moss says. James.
Yeah, I would start by saying that the California Department of Corrections is unwilling to release anyone in response to this pandemic. They have fought this tooth and nail every step of the way, even though every public expert, every medical expert, legislators, the judicial branch, community members, and advocates have all weighed in to not only say that releases are the safest thing to do in response to this pandemic, but also that we are standing by to support those releases. So they have all of the information. They know that it's not only politically viable, but that there's support for it, like material resource, and yet they still are resistant to conducting any type of...
James, why?
Well, I think that the bottom line is that this is our reliance and our addiction upon incarceration as a means for social control has been part of our society for decades upon decades. We have 35 prisons within our state that hold close to 100,000 people right now. You don't get there without being devoted to that as a policy and as priority issues, that we are going to incarcerate our ways out of marginalization, disenfranchisement, a lack of resources and resource sharing in our communities. So there's a very specific model that California believes in, which is that incarceration keeps us safe. Us as advocates are saying that is false, that is categorically untrue. What keeps us safe are having basic affordable housing, just having an income, a reasonable living wage, having access to reasonable medical and mental health treatment when needed. Those are the things that actually keep communities safe and build communities up. And our governance at this point has a different philosophy.
James, I'm just looking at some of the advocacy.
Sorry.
So, excuse me, Adnan, I'm coming right back to you, though. Some of the advocacy that you're doing, releases, not transfers, town hall, that is coming up. Adnan, from your organisation, Stop San Quentin Outbreak Coalition, and I'm wondering if this may well be an opportunity. There have been so many protests, so much advocacy. Let me just bring in this last comment, Adnan, and then you jump off the back of it.
Governor Newsom and CDCR have an opportunity, and that is to stop the further spreading of COVID-19 by stopping all prison transfers and also stop dropping people off at ICE detention centers. Sadly, we can't go backwards. We can't correct terrible decisions already made, but what we can do is we can stop making terrible decisions. We can understand that there are many people, many vulnerable people within a vulnerable population with comorbidities who have loved ones ready for their safe release, who have organizations planning for safe release. And this is a place where we can all lean in and understand that we have an opportunity to save lives.
8 months into this global pandemic, so many lessons learned, lives lost, Adnan. Now what?
That's what I was going to bring up, Femi. Thank you for saying that again. Lessons learned. Lessons have not been learned. And there is a clear example with the chart you gave earlier. Right now in Corcoran, which is in Central California, I spent 5 years there. There's 392 cases, active cases recorded right now. And like you said, 8 months into a pandemic, after 80 deaths, over 16,000 recorded or reported COVID cases in California state prisons alone, right there, what you're showing now. What lessons have we learned? If you look at the left side right here, 150 active cases in the last 14 days, 392 cases in the last 14 days, and these are 2 different facilities. And we are 8 months in the pandemic. That means 8 months without visits. So family, programs, volunteers have not been coming in. So who has been bringing and taking COVID out of these facilities for the past 8 months? And who, talking about they're not wearing masks properly, you can't social distance or physically distance in prison. And we've been saying that since March. And why, for us to repeat that in November on election day at that, it just mind blowing to me. And so when we talk about accountability, and society can constantly blame people for committing crime, and you do the time, you do the crime, you do the time, stay in prison. Well, the truth is, if we're asking people to be accountable for the crimes that they've committed and for breaking the law, well, we as a society and as a government have a legal responsibility to provide adequate health care for people that we incarcerate. That is a law. So it's very hypocritical to tell people to demand accountability from people and not hold ourselves accountable to a law that we have to be governed by. So there's many discrepancies here that continue to contradict themselves when people like myself, James, and Danielle talk about COVID, and when the government and the governors talk about COVID. So what has stopped? 392 cases right now actively as we're talking. But we continue to highlight the super spreader events at the Rose Garden at the White House lawn. We talk about that, but we don't talk about the 392 cases that are happening right now that have staff, like James mentioned, coming in and out of that prison every 8 hours into our communities.
Adnan,
we don't talk about that.
Adnan and James and Danielle, thank you so much for being part of today's programme. Adnan, there are so many more questions about what happens if you release people right now during a global pandemic, which is why I'm really glad that you're going to be our Instagram live guest a little bit later on in about 30 minutes from now on IGTV at AJ Stream. That is where you'll find him. And if you don't have time to do that, very soon. You'll find it any other time. So have a look here on my laptop, because we have been talking about the new Fort Lauderdale documentary, Pandemic in Prison, the San Quentin Outbreak. You can find it online, and you can also find it on Al Jazeera TV as well. Thanks so much for watching. I'm Femi OK. I'll see you next time. Bye for now.